Everybody see my screen okay and hear me okay?
Yes.
All righty. Well, we'll go ahead and get started. So this is a CPR AED awareness training. The goal for this is just to cover a few things, statistics, talk about hands-only CPR, what does that actually mean? Talk a little bit about AED devices, talk about the Good Samaritan law, and finally just give you a few resources to use. So there is just a disclaimer that I like to share that this is a training just for awareness only. It does not have any kind of official credits or anything to get you certified, but we will talk about how to do that later on in the presentation. So to get started, just to give you some idea of some heart disease statistics in the United States, it is the leading cause of death for men and women and people of most racial and ethnic groups in the United States. And these statistics are from the CDC, Centers for Disease Control. One person dies about every 33 seconds in the United States from cardiovascular disease, and about 695,000 people in the United States died from heart disease in 2021. So that's about 1 in every 5 deaths. Heart disease is still pretty costly. It's about $240 billion a year, and that was from 2018 to 2019. And this does include the cost of healthcare services, medicines, and loss of productivity due to death. So it's quite significant. Some other heart attack statistics in the United States, someone has a heart attack about every 40 seconds. And so that's about 805,000 people each year that have a heart attack. And of these, 605,000 are their very first heart attack. 200,000 happen to be people who have already had a heart attack. And about 1 in those 5 heart attacks are silent, where basically there's not really many obvious symptoms, but the damage is done and the person's not even aware of it. And from other things that I've read, this seems to be more frequent in women versus men, that they have what they call these silent heart attacks. So just to give you a few more statistics, you know, there are folks that have what they call a sudden cardiac arrest. And in 2019, you know, any mention of people having a sudden cardiac arrest was about 370,000. And then in 2020, the majority of out-of-hospital cardiac arrest either occurred at a home or residence. And then the other in public settings is about 15%, nursing homes around 11%, and they were the second and third most common locations of these. So according to 2020 U.S. data, their survival to hospital discharge was 9% for all EMS treated non-traumatic cardiac arrests. So bystander witness arrest had a 31.2% survival to hospital discharge, and 911 responder witnessed arrest had 36.2 survival to hospital. So that just kind of gives you an idea of, you know, what the percent is, you know, depending on the type of situation with the cardiac arrest. So, and these statistics here are from the American Heart Association. So what I provided in here is I've got a handout that's for hands-only CPR. It used to be several years ago, when they were doing the CPR certification, that they taught to do the breathing part along with the hands only way of doing CPR. So after some research and looking this over, it came to the conclusion that basically hands only will work just as well without the breathing part when you're offering the breast to someone in these situations. So I'm going to open up this. This is from the American Red Cross, and this is just basically a step-by-step instructions of what to do when somebody collapses and they go into cardiac arrest. And I'll just run through this. So first of all, check and call. Check the scene, make sure the scene is secure and okay, and then check the person. Tap them on the shoulder, shout at them, "Are you okay?" Try to get a response from them, and check and look to see if they're breathing. So if there's no obvious response, go ahead and call 911. And then if they are unresponsive and not breathing, start beginning those chest compressions. If you have them available, you can use disposable gloves. Like I said, check for those occasional gasps that they are not breathing. Then secondly, as you start giving those chest compressions, just place the heel of one hand on the center of the chest and place the heel of the other hand on top of the first hand, and then lock your fingers together as the picture shows there. Keep your arms straight, position your shoulders directly over your hands, then push hard and push fast. So you want to compress the chest at least 2 inches, and then do it about 100 times a minute, and let the chest rise completely before going back down again, and just keep continuing those compressions. So that's what you do in step 2. Step 3 is basically don't stop, except in one of the situations, if you start to see obvious signs of breathing or they're coming around, or if another trained responder comes in and takes over, or EMS arrives, or if you're just too exhausted and you need to have a partner come and relieve you, or if you have an AED that's available, or if the scene becomes unsafe, that's when you want to kind of stop. But at all possible, keep those compressions going. And then finally, if you have an automated external defibrillator, an AED, there are some instructions there to how to use it. Pull it out of the case that it is and open it up, turn it on, wipe the chest dry, attach the pads where it tells you, plug in the connector if you need to. Make sure no one is around you or you're around touching the individual once you do the shock, because if you're touching that person and you shock them, then you're going to get a shock too. So we don't need 2 people in that situation. And then push the analyze button. If the shock is advised again, you push the shock button, and then perform compressions and follow the AED prompts. So hopefully that will bring the person back to where they needed to be in those situations. So and this is from the American Red Cross, so that's a nice little hands-only way to do CPR. So let me go back. So does anybody have any comments or questions about that so far? If not, there's a quick little video here that actually demonstrates that in more detail. So I'm going to click on that, and hopefully everybody can see and hear that.
How to perform hands-only CPR. Cardiac emergencies can happen anywhere. Be prepared with a simple technique known as hands-only CPR. You can learn it in minutes, it's easy to remember, and it can help save a life. You will need the willingness to act and a few simple skills. Whenever possible, use disposable gloves when providing emergency care. Step 1. If you see someone suddenly collapse, check the scene for safety and then see if the person responds to you by tapping them on the shoulder and shouting, "Are you okay?" Step 2. Briefly look for breathing. Step 3. If they don't respond, call or send someone to call 911 or the local emergency number right away. Step 4. If the person is not breathing or is gasping, prepare to give chest compressions. Kneel beside them and put the heel of one hand on the center of their chest. Place your other hand over that hand, lacing your fingers together. Position your shoulders directly over your hands, keeping your arms straight and your fingers off the chest. Step 5. Push hard and fast, at least 2 inches, then let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Step 6. Keep going. Do not stop compressions until the person shows an obvious sign of life like breathing, the scene becomes unsafe, an automated external defibrillator or AED is ready, you're too exhausted to continue, or a trained responder takes over. Step 7. Get training and encourage others to do so by taking an American Red Cross health and safety course. Knowing full CPR, chest compressions, and breaths will enable you to help in other emergencies such as drowning and choking. Every household should have at least one person trained in life-saving skills. Did you know? Most people who survive a cardiac emergency are helped by a bystander. To find your local Red Cross chapter, visit redcross.org.
All right. Hope everybody was able to see and hear that okay. So that's a good little video there for the hands-only CPR. The next video is just another short video that's going to be talking about AED devices. So if you go to a lot of the municipalities, the county buildings, most of the time you will see these AED devices on the wall or available. I think a lot of the local governments are starting to have more and more of these out, to be used if needed. So what I do, um, even though I'm a safety kind of person, I'm always going to different buildings when I go to meetings and so forth, or if I'm out at other events, I'm kind of watching and looking to see if maybe those are visible and out there. Just because you just never know, when somebody's going to need something like that. So let me just show this video real quick. Can everybody see and hear it okay?
Yes.
Okay. All right, here we go.
Are you okay? Are you okay? You, call 911. You, get an AED.
This is a scene that plays out over 1,000 times every day in the United States. If you see or find an adult or teen who has collapsed, they could be in cardiac arrest, and you need to act now. Assess for any signs of movement or normal breathing. If the person has slow, deep gasps, this is not the same as breathing. Call 911 or direct someone to call. Treat. Press hard and fast on the center of the chest. Place the heel of your dominant hand directly on the center of the chest and interlock the fingers of your other hand. Keep your arms straight and lean over the victim, using your body to compress the chest. Push down hard. You need to compress the chest at least 2 inches and push 2 times every second or 120 times per minute. Allow the chest to recoil completely with each compression. If the victim is on a soft surface, like a bed or a couch, move them to the ground before beginning compressions. You may have heard in the past that you must do mouth-to-mouth ventilations. Mouth-to-mouth is not needed for adults or teens and could be harmful. Perform chest compressions only. However, mouth-to-mouth is needed for young children and infants. While performing chest compressions, direct someone close by to get an AED. The AED, or Automated External Defibrillator, is the only thing that will shock the victim's heart back into normal function. When the AED arrives to the victim, simply turn it on and follow the voice-guided instructions.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR.
The AED will only deliver a shock to someone who needs it, so do not be afraid to put it on anyone who is unconscious. Now that you know how to act, let's watch this again.
Are you okay? Are you okay? You, call 911. You, get an AED.
Keep your arms straight and lean over the victim, using your body to compress the chest. Push down hard. You need to compress the chest at least 2 inches and push 2 times every second or 120 times per minute.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Shock advised. Press flashing shock button. Shock delivered. Start CPR.
In many instances, an ambulance or other medical professional can be 5 to 10 minutes away or more. Continue chest compressions while rotating compressors every 2 minutes until help arrives, and continue to follow the instructions of the AED or 911 dispatcher. You be the hero. Teach your friends and family to act now.
Alrighty, so there you go. That's the video there on the AED devices. So if you ever have a situation, and hopefully not, but if you do, don't be afraid to use these. So that was a good video on that. So this question here, there's a question that comes up about, when you're out somewhere, and this situation does happen. I got this from the internet through a Charlotte CPR class. The question came up, what are the obligations and expectations, both legal and civil, of knowing CPR and or being certified in CPR, and then you face the situation if someone needs CPR. So it's kind of a both simple and complicated answer. But being certified in CPR does not in any way obligate you to perform CPR to anyone who might need it. So according to this, nothing obligates you to perform CPR. But on the other hand, if you're a trained doctor or, medical professional, that's something different. But basically the answer to this is, if you're responding to someone in an emergency with CPR, whether you know CPR or not, or certified or not, as long as you perform this in a non-negligible, reasonable manner, If you happen to injure the person even further, or you do not successfully resuscitate them, you cannot and will not be held criminally or civilly liable. And so North Carolina is a state that has the Good Samaritan law. And this is the actual statute here, which basically, covers you for offering assistance like this to someone who needs it. So, yeah, it's good and probably makes you a more confident person if you do have the CPR certification. But you are covered under the Good Samaritan law if you need to perform that on somebody, and it also applies to AEDs as well. Um, so the only other thing I was going to add here there are some resources available for those that want to get certified in CPR and AEDs. I would say, first check with your local county health department or your local community college. They will offer some ways to get certified, some training classes. I think a lot of the community colleges now offer some type of certification in CPR and AED. Some of these there is a cost involved, but in a lot of situations you can actually get training outside of that will be minimal or no cost. You can go to the American Red Cross website there on the screen, to look to see what kind of training is offered and where and when. You can also check with your employer. A lot of times, your employer will be able to offer that training, you know, um, like with your local county or state government. I know we get offered this training every so often. Working with state government, that's how I got my certification. So in general, the certification does last. I think it's about 2 years. Depending on where you get certified. So it is something to get and to keep, keep active, because once it expires, you do have to renew it to keep your certification. And they usually give you a card, and you just saying that you've been certified in CPR and AED. So, and I can't stress enough, it's a really good thing to have, if you are certified, but as a reminder, if someone is in dire need of it, you do not have to be certified to do that. So, and like I mentioned earlier in the presentation, you never know when you're going to be out in public at a ball game or just, with family or friends, and something like this happens, because it can definitely save a life in a lot of situations. So I think I just stress that this is one of the best safety certifications anyone can get. So that's about all of the presentation that I've got. And I'll be glad to answer any questions or comments anybody's got. Feel free to speak up.
Hey, Ken, this is Edward.
Hey, Edward.
Hey, Ken, I appreciate you. I know I've been after you in the safety meetings saying we need to talk about this, and I think you've got it covered very well. Before we go, I want to just tell you how important this is. I've been with the volunteer fire department in a very rural area in a big county, a rural big county down here in Bladen, where everything you need will be there in 20 minutes. And that's a long 20 minutes. And my neighbor, this was all like in 2018. She literally fell dead in her house and her husband, who was our fire chief at the time, he ran a perfect 20 minutes of CPR, and she's alive and well today. And the doctors, her cardiologist says, I really don't know what's wrong with you. We can't find anything. Most people that say cardiac death on their paperwork are dead. And she said, but here you are in my doctor's office in Chapel Hill. So she's got a pacemaker and a internal defibrillator now. But that his knowledge of CPR really, it literally saved her life. And I want to tell y'all something about doing CPR is it's not hard to do. You will be tired. You will be upset after it's over. You're going to feel bad tomorrow because you're going to be stove up and stiff, and you're still going to be upset because you saw somebody hit the floor in front of you. But what we're trying to do with CPR, just think about this. You're trying to pump enough air in them to keep their brain alive, because everything else, as long as you can keep the back, basically the back part of your head alive, keep enough oxygen to your brainstem, the EMTs are coming with a whole big bag of stuff you don't even want to know what they've got, and they can add stuff, do all their stuff. But all you have to do is just keep your heart pumping, keep the blood flowing, and when you're doing compressions, and like I say, you're gonna do them hard. What that does is it forces enough air in and out of your lungs that you don't have to do the breathing thing. Now, I don't know if one's particularly better than the other, but it does work, and that's something to know. And the AED stuff, that doesn't look like on TV, like where they really get being out of shape. It's very subtle, but you can see when it shocks them, and it'll get their heart just kind of ticking back in the right direction. And that's I've seen that, I've done that. Like I say, you're gonna be in a funk tomorrow if you do it this afternoon, but it really makes a difference. And all you're trying to do is buy some time till somebody gets there with more stuff. And once that happens, they'll say, okay, thanks, and you're done. So that 3, 4, 5, 10 minutes really makes a tremendous difference on there. So and don't be afraid about hurting somebody. They're unconscious. They're on the way out of this world. They are dying right in front of you. So jump in there and do some compressions and do them hard. Don't be afraid of. You're not going to break anybody's ribs. You can really put the work on them with that stuff. So I thank everybody for participating in this training. Ken, thank you for putting it on, because like I say, I've done it. I've seen it work. I've seen it not work, but I've seen it work. So hey, it's better than standing around wondering what to do. Do something, even if it doesn't. It may work. But thanks, Ken.
Yep, you're welcome. Thank you, Edward, for that information. So I've in a couple of the trainings I've been to, one of the instructors actually had a guy that I guess they were doing CPR on, and believe it or not, they had been doing it for almost an hour. I think it was like 45, 50 minutes, like continuous compressions. So you get to that point where you think it's not working, or you're not getting a response, but hang in there and keep doing it. Now that might be one of the longest times somebody's had compressions. I'm not sure, but they told us in that training that and when somebody tires out, they would just try to get somebody else to take their place and just keep those compressions going, like Edward was talking about. You just never know when this stuff's going to happen. I mean, we see it on the news, like I said, the athletes and people in restaurants, even the airline pilots, which that may be a little bit harder in those type situations. But you never know when something like that's going to come up, and if you can jump in and offer to help save someone's life, that's always an awesome thing. So good deal. Does anybody else have any questions or comments?